Welcome to Adapting Class. Today, we're going to talk about how to study physiological adaptation and actually pass this portion of the NCLEX. We're going to discuss what is physiological adaptation, what the NCLEX is asking, how to approach questions regarding that, and how to master this portion of the NCLEX. Stick around, let's get it done. First, information. You have to know what is physiological adaptation. What is the NCLEX actually asking? What is it all about? The word is physiology, your body, adaptation, you having changes in your body. That's all. What it means is your body is adapting to or compensating to changes in illness, injury, or treatment. So if you injure yourself, there's certain changes that occur for your body to adapt to that. The NCLEX wanted to know if you can identify these changes when it happens. So what is the NCLEX looking for? What is the NCLEX testing? They are checking if you can identify the body adaptation and whether this adaptation is failing. So when you're taking care of a patient and it adapting, are they failing? That's the key. Example, a patient in heart failure, they're going to compensate. Their heart rate goes up. But if they continue, they're going to decompensate. So you have to pay attention to that. A client in DKA, they breathe very fast, Cushman breathing. Why? They're compensating to the metabolic acidosis. The NCLEX want you to understand that. And then a client whose blood pressure is what, 80/60, heart rate of 120. What do you think is going on? That patient is in shock. If he's in shock, there will be physiological changes on the body, right? You have climbing of the skin, cold skin. If you have hypovolemic shock, so all these physiological changes, the NCLEX is looking for that in your selection of answers that you can identify client needs and you can identify them when they are adapting to physiological changes and these physiological changes is failing. So what are we going to talk about? The individual system, the cardiovascular system, this is what they're testing. Know your heart failure. Know everything about heart failure. MI, myocardial infarction, and shock. All the stages of shock. I will link a bunch of videos associated with this system if you need help with that. And then EKG, of course. You don't freak out, but just know certain things about EKG and individual cardiac rhythms. Of course, never forget PE and DVT. These are all associated with the cardiovascular system, even though some people think even though you may think is a respiratory problem, it also can affect the cardiac system. So this is what they're testing. So what are you looking for? Every time you see a cardio question in physiological adaptation, think about what? Perfusion. Write it down. Stop the video. I want you to write it down. Cardiovascular complication, always perfusion, because your heart is not going to pump. Now, respiratory. What is the respiratory system they're testing? ARDS, acute respiratory distress syndrome, COPD, asthma, and respiratory failure. You got to master these areas. You don't have to know everything, but the key thing on how to identify them and how to manage them. Patient oxygenation and ventilation. Few things about ventilators and their associated changes like changes in alarm bell, all those things. This is where it falls. So I'm giving you this so that you can use it and know the areas you need to study on physiological adaptation. ABG, of course, you can't run away from it. Everybody have a strategy. Whatever worked for you, stick with it. Mechanical ventilator complication, I talk about it, right? Alarm bell changing, ET tube coming out. These are all key. But what should you focus on the question? Is a respiratory distress. And what does respiratory distress does? Hypoxia. What does hypoxia lead to? How would you know this patient is having hypoxia symptoms? That's what you look for in the question. You've seen it before. When you solve questions, you see what I call them buzzwords. What are those buzzwords? You know them. What do you think? List them, put them in the comment and let me know. I want you to list them in the comment. Respiratory buzzword that you should not run away from it. Confusion, me, this is number one, right? Restlessness, this is another number two. And saturation going down. These are three things that are consistent with what? Respiratory problem. You can have stridor. This is also a respiratory issue. So pay attention to these buzzwords associated with that. And your job is to what? Look for those signs that tells you this is early signs. So when you're doing prioritization, you know I got to see this patient first. Fluid electrolyte is big. Fluid electrolyte is big. I got you. You don't need to worry about it. Know the key aspect of them. Sodium, what is the major role of sodium? It's fluid balance. So know when to use, which fluid to use in certain situation. Potassium, always, is going to be cardiac issue. So pay attention to that. And then magnesium and calcium, they deal with the muscle and the nerve, right? You have spasm, you have hyperreflexia, all the signs and symptoms associated with hypo and hypercalcemia or magnesemia. Easy way to remember it, I call it the easy way to remember these guys is what? Calcium. If your calcium is high, look for signs and symptoms that is going to go down. So you have depression, you have weakness, you have constipation. If your calcium is low, look for signs and symptoms that is going to go up. Strengthening, right? Spasm, right? The C and the T signs, those are the things you should pay attention to. Same thing for magnesium. And of course, acid-base imbalance. You'll be able to identify which is acidosis, alkalosis, and what is the compensation. So that's the key aspect. Next thing is neurological problem. These are areas I want you to be comfortable with. Stroke, know the difference between stroke, ischemic and hemorrhagic stroke. How do you manage them? In terms of TPA, what do you do when the patient coming with stroke? How do you identify that the patient have stroke? The fast sign. Like you say, this is the study of how, but not the content, but I'm showing you the key aspect where you need to pay attention to know them that, oh, I've mastered physiological adaptation. Know the things you need to do for ICP, how to manage them, how to identify them, especially in kids, because they are different. Like what? Sunset highs, right? Bulging fontanelle. All these signs you have to pay attention to. In seizures, the key things about seizures, I want you to write this one down. Don't just know what a seizure is, but know what you need to do before, during the seizure, and then after seizures. It's very, very important. And what pharmacology do you use when the patient is having seizures? And what you should use when they're not having seizures? The maintenance one and acute situation. The spinal cord questions are always straightforward. Why? Because most of the time they're going to ask you autonomic dysreflexia. To be able to identify what are the signs and symptoms of autonomic dysreflexia. Who is the common patient they're going to ask you? Somebody with the injury above thesis. These are all classic signs and symptoms. I want you to pay attention to that and write it down and study them, because then you master these areas of the NCLEX. Next one, endocrine. Don't worry about it. These are the only few things you need to work. Acute kidney injury. You need to know what chronic and acute, how did they present, what the lab look like. And of course, you can't run away from diabetes because a bunch of people have it. They're going to ask you the difference between DKA and HHS. And then on the endocrine aspect, right? Thyroid storm and the difference. The way to study endocrine is to do bidirectional. You see, there's always hypo and hyper symptoms, right? Hypothyroidism, hyperthyroidism, SIDH, DI, they are all opposite. So if you know one side, you already know the other side. Don't worry about it. Adrenal crisis and Cushing. This is where endocrine symptoms always fall under what? Physiological adaptation. So know what you need to do for each situation and how to manage them. The GI thing is straightforward. pancreatitis, GI bleed, liver failure, bowel obstruction, and paralytic ileus. The common theme about all of this is what? Bleeding and peritonitis. So know the signs or symptoms of somebody with the GI symptoms that is having bleeding or they're having peritonitis. So I know you know them. Put it down. GI physiological adaptation, signs and symptoms of badness or of bad things happening, peritonitis and bleeding. What do you think the patient will show when they have what? Peritonitis. Put it down in the comments and let me know. The NCLEX is not testing your memory. It's just testing about your judgment. And you have to know things about this information using physiological adaptation. If you watch my video, I talk about this all the time. You know, early and late signs of hypoxia is a component of them. Compensation and decompensation shock, increasing ICP, ABG. We've seen it. But what am I talking about? This prioritization. I call it B sharp. You're looking for a breathing issue, electrolyte, shock, sepsis, airway, lethargy, and pain. You can see all this thing is consistent with physiological adaptation. We saw breathing, we saw electrolyte, we saw some shock symptoms, we saw hypothermia, we saw what? Airway issue, neurological issue. All of this is part of the physiological adaptation because those are all bad problems. But how do you do prioritization? Is this pathophysiology, which is the same thing as physiological adaptation. There is going to be changes in your physiology and you have to adapt to it. But if you fail, somebody needs to identify it. And that is what the NCLEX is doing. What is the key? Ask yourself, is this an urgent question? Is it a situation where I'm getting warning or unexpected finding? That's why I call it B sharp, not expected. That's prioritization. If you need more, I will link a prioritization video in the description and you can watch it. But this is the way I do prioritization. This is the way I get that idea from. Is it an urgent situation or I'm getting a warning sign or unexpected finding, normal, stable things that I can see? If you put these together, you master physiological adaptation. Remember, cardiac, we're looking for perfusion. Respiratory, we're looking for signs and symptoms of hypoxia. Neurological problem, we're looking for what? Anything that can affect our neurological status. That means changing what? That means changing level of consciousness. These are all perfusion problem. If you have electrolyte issue, each of them has their own problem. Sodium, fluid, potassium, cardiac, calcium, magnesium, dealing with muscle and what? Nerve. And when you go to the GI, worry about bleeding, worry about bleeding, worry about bleeding. And then there's another category that I want you to pay attention to. The renal aspect. If they give you a kidney question, renal, all they want you to do is assess before you give. That means every time they give you a renal question, check the patient lab work, right? Make sure they pee before you give them medication. That's all. If you're going to give them antibiotic and they have renal effect, you got to make sure you check their lab. Their creatinine is fine. So this is the way they making you think about physiological adaptation. Now, let's put it together. Now, let's apply what we learned carefully. A post-op client suddenly becomes restless, has a low saturation, and they complain of what? Chest pain. There's a bunch of buzzwords in the question. You know this patient is not doing well. It's adapting. What word in the question as a buzzword will you focus as number one? Write it down. Put down in the comment, hashtag scenario, and what you think you should focus on. Is it post-op patient? Is it restlessness? Is it what? Low saturation and chest pain? I'm going to focus on post-op. And that will give me an idea. If you just had surgery, you have restlessness, low saturation, and chest pain. What do you think are the possible etiology of that condition? This patient probably has what? Think about it. This is physiological adaptation. Patient is changing physiologically. They don't look well. What do you think? This is pulmonary embolism. It's occurring, right? And the early signs is what? Hypoxia. Patient is showing you they have restlessness. Their sat is going down and they're starting to have chest pain. These are all mark of what? Pulmonary embolism, because they have surgery. It's not heart attack. It's not MI. So in an answer choice, I'll give you things about heart attack, but if you pick it, it's wrong. Now, what is the next step we do? You raise the head up of the bed, you give them oxygen, you check their respiratory rate, apply your nursing concept. There's a way to do it, prioritization. I call it B sharp. You can check my B sharp I'll link it to this video. But what do you think you should do? I know there's always people say A, B, C, but it doesn't matter. Whichever work for you. What do you think? You know, if you go with the A, B, C, go with it. But remember to know whether it's urgent, something warning sign, or expected finding. I don't think this is an expected finding. Patient is having respiratory distress, is having breathing issue. Therefore, provide some breathing opportunity for the patient, right? What would you do? Raise the head of the bed and apply oxygen, and then check their respiratory rate. The first action the nurse should do is what? Very, very important. Repositioning improve lung expansion, and that improve their oxygen immediately. Then you can address their hypoxia and give them oxygen, right? Before you can look at the respiratory rate, it's not going to help you, but reposition will help this patient. This patient need to be stay with the patient, check their vitals, listen to them, get an ABG. If you take the test, they may give you something we call D-dimer. But this is physiological adaptation in what? Action, right? This is the key. If the client can breathe, nothing else matters. So that is that situation. And these are concepts I'm trying to show you to master this portion of the NCLEX, physiological adaptation. This is how to study. This is how to look at it. This is how to look at each question. And this is how to master it. You can see in a very short time, you know what to do, how to study, which areas to pay attention, what is the priority for each concept regarding physiological adaptation. Thank you very much. If this video helped you understand that the physiological adaptation, click on the like button or write a small comment. Thank you very much and good luck in your exams and nursing school. Bye.